Hi, I'm Jeffrey Smith, President of Synectics for Management Decisions Incorporated. With the support of our partner 540.co, we're proud to present you with LifeLink, matching demand for the behavioral health workforce.
Building a strong behavioral health workforce is paramount in a healthcare system that promises effective treatment for better client outcomes. The current needs for mental health and substance abuse treatment services across the nation beg for an adequate supply of qualified and well-trained behavioral health professionals and paraprofessionals.
People seeking services frequently struggle to obtain timely access to a qualified provider. In 2014, an estimated 11.8 million adults perceive an unmet need for mental health care at any time during the past year, including 5.3 million adults who did not receive any mental health services. 75% of rural or frontier counties have no advanced behavioral health practitioners.
According to a national study, 49% of clinical directors at substance abuse treatment facilities acknowledge difficulty in filling open positions, and more than half of that 49% said there was a lack of qualified applicants. The United States Congress, in its 2012 Senate report, voiced concern about the growing workforce crisis characterized by worker shortages, an aging workforce, stigma, inadequate compensation, and high turnover rates ranging from 18.5% to more than 50% for the addiction services workforce.
We don't anticipate that this situation will improve on its own. In fact, with the implementation of the Mental Health Parity Act and the Affordable Care Act, the number of individuals seeking behavioral health services will increase. This may only exacerbate the current workforce challenge.
Team SMDI has risen to this challenge and would like to introduce LifeLink, an interactive technology solution that matches the applicant's skill set with the requirements of the job. The goal is to provide immediate feedback on job matches and facilitate first contact between the job seeker and prospective employer. Each match is measured for compatibility and given a behavioral health match score. This feedback is provided to both the applicant and the prospective employer, and an email link is made available to facilitate first contact by the parties.
LifeLink will cut short the delay in the job search and start the process of bringing the appropriate skills and expertise where they're necessary. We anticipate an ultimate outcome to be shorter wait times for individuals seeking mental health and substance abuse treatment services. Not to mention the ripple effects it will generate on the overall outcomes of the individual as a result of early intervention. To accommodate anticipated growth, the platform is being developed from the ground up with cloud computing in mind. We are utilizing the elastic computing capabilities of Amazon Web Services, and since the architecture does not present inherent technical bottlenecks, the solution can be scaled to tens of thousands of concurrent users. All the information and every action that takes place and exists within LifeLink is captured. Through the use of analytics and visualization, LifeLink will help key stakeholders better understand the labor market for behavioral health.
The academia, for example, can access information on existing skills available in the labor market, employable skills, identify gaps, predict future expertise needs, and thereby plan the necessary adjustment in their curriculum to remain responsive to the needs of the industry.
Training and technical assistance support from the government may also be guided by information that shows comparative analysis of the gaps in workforce across states, within states, or at the regional level. LifeLink can be an ideal technical solution to ongoing behavioral health workforce initiatives that creates linkages to resources among federal, state, local, and tribal partners.
And finally, we envision that certain analytical data sets from LifeLink will be accessible to researchers, innovators, and government agencies in a safe and fully compliant manner.
Please try our proposed solution, LifeLink, the key to finding a diverse, qualified workforce for better behavioral health outcomes.
Welcome. On behalf of Team SMDI, I invite you to the presentation of our LifeLink prototype. LifeLink has the ambitious goal to improve the delivery of behavioral health services to people in need. But let's get started. Our platform has three major stakeholders: the behavioral health workforce, the employers and academia and government, which can use the analytics and visualization engine to support decision making. The platform is running on top of Amazon's Elastic Cloud and utilizes compute instances, networking, Elasticsearch, and Kibana as charting and visualization tool. The application has been developed in AngularJS and used RESTful calls to the backend to retrieve and store data. Now, we will start with the experience of the workforce. So we log in as the applicant. After logging in, the applicant is able to populate attributes of his or her profile, as well as upload their resume. They are able to upload more than one resume. Resumes are then listed in the Resume section, and clicking on one shows potential matches of job postings. The match is really important. We match concepts of the applicant's resume with concepts of the employer's job posting. It is computed from many sources, weighted by our machine learning network and based on our domain knowledge in behavioral health. It is able to produce more accurate matches than searching by keyword alone. We call this the BH score. Clicking on the heat map, the applicant can see the distribution of jobs and workforce across our nation based on certain skills. This is being computed by Kibana in the backend based on Elasticsearch. Now, let's look at the employer perspective. After login, the employer can update its profile and start posting jobs. So we're going to type one job in here. For example, a clinical psychologist with 3 years experience. Pick a date. And submit. All jobs listed can be reviewed on the jobs listed page. And again, we see the BH score, which is the concept matching algorithm, the result of the concept matching algorithm. The heat map can give a quick overview over the situation of the workforce and the job distribution in the country. And last but not least, let's take a look at the third major stakeholder, which can be a government employee or a university program manager. We call them analysts, or people who would like to use our data analytics capabilities. After login, this person is presented with an interface to perform historical as well as predictive analysis. This section will improve over time as we collect more information about the applicants and the job postings. For the prototype, we focused on the skill distribution for the workforce and the jobs, the top 5 areas for a given capability, and the most sought after skills. Top 5 areas for various skills. And the most sought after. So, we hope you enjoyed our prototype. We have many more ideas on how to mine the data collected from the workforce as well as the employers to support decision making and enable faster access to behavioral health than ever before. Thank you.